Hi guys, in this edition of Life at 50, I'll talk to you about how to isolate yourself at home if you have a COVID-19 infection. Cheers! Well guys, since July 23rd, the Ministry of Health has announced that all patients who have been diagnosed with COVID-19 infections in the Klang Valley need not go to the COVID assessment center. They've been advised to isolate themselves at home while monitoring for symptoms. You do not need to go to the COVID-19 assessment center anymore to get a pink band. All you need to do is stay at home, rest and recover while monitoring your symptoms. So once you're tested positive for COVID-19, you go to the help desk on your MySejahtera app. Click on the icon that you are COVID positive. They will ask you a few questions asking you where you did the test. You then have to upload your test result. Once that's done, your status will be changed to symptomatic with a home surveillance order for 10 days. You will be asked to monitor yourself daily and send a report back to the ministry through the MySejahtera app. And let me show you how to go about doing this. Cheers! So every morning while you are isolating yourself at home, you have to open your MySejahtera app and answer all the daily questions regarding your health status. Answer all these questions including your blood pressure, pulse oximeter, oxygen saturation and temperature. So you need to measure all these values first. Once you have answered all these questions, enter yes and you are done. Guys, you know there are 5 categories of COVID-19 infections, from category 1 to category 5. Category 1 and 2 is the mild form of COVID-19 infection. Category 1 meaning asymptomatic infection. You got a positive diagnostic test for COVID-19 but you don't have any symptoms. And category 2 is when you have mild symptoms. So for category 1 and 2, you are advised to stay at home and monitor yourself. You only need to go to the hospital or COVID-19 assessment center if you have warning signs and symptoms. And I'll talk to you about it now. Cheers! So what are the warning signs you need to look out for when you monitor yourself at home for COVID-19 complications? Number 1, difficulty in breathing or shortness of breath. If your oxygenation on your pulse oximeter goes below 95%, if you start to get confused, if there's frequent vomiting and diarrhea, if there's increased lethargy, you don't pass urine so often as before, you have poor appetite and are unable to take your food as normally, you get chest pain, you got blue discoloration in your fingertips and your lips, and you start coughing excessively with blood. If you have any of these signs and symptoms, you need to contact your healthcare provider immediately or the COVID-19 assessment center. The pulse oximeter is an important tool in the home monitoring of COVID-19 patients. What you need to do is check your oxygen saturation 2 times a day at least. So, if your oxygen saturation drops below 95 to 96%, then this is a warning sign which you need to take into account and inform your doctor. Another important test to do is the 1-minute sit to stand test, which should be done every morning. What you do is, first check your oxygen saturation level with the pulse oximeter and then start doing sit to stand exercises as many times as you can within 1 minute. After this is done, you then recheck your pulse oximeter oxygen level again. A 3% drop in the pulse oximeter reading after exercise is a significant finding, and then you need to inform your doctor or the CAC. Make sure you buy your pulse oximeter at a reputable place. Caring Pharmacy is one of them. Be wary if you order your oximeter online because there have been reports where the oximeters give false reading when they are bought online. You also need to monitor your body temperature with a thermometer. and your blood pressure if possible with a home blood pressure monitoring device. Cheers. For caregivers looking after the infected COVID patient, make sure they wear a mask if they approach the patient and practice proper hand hygiene. Wash hands after touching any object or sanitize your hands after coming into the room or in contact with the infected patient.
Morning, breakfast. Palm, coffee, and banana.
Ideally, the patient should have his own room with an attached ensuite bathroom. So you can see in this instance, I'm staying in a separate guest room which is isolated from everyone else. The windows are all open to encourage the movement of air in and out to reduce risk of transmission of the COVID germs to other people. And there's also an ensuite bathroom which is not shared with anyone, it's only for one person's use. All eating utensils used by the patient should be separated and washed separately. This includes his clothes. So this is the view from my bedroom as I have breakfast every day, the sound of running water from my waterfall, and watch the plants in my garden. Make sure you have good nutritional meals and adequate hydration during your isolation. You have to keep occupied during your isolation. Here I've got a book I'm reading. I've got my GoPro Hero 8 camera which I'm using for taking videos. I've got my external hard drive with movies to watch, and also my laptop for me to surf the net, look at latest news and do my YouTube videos. And fortunately for me, the Olympics was going on, so I could keep abreast of sporting events live on Astro. I also indulge in a little bit of alcohol to keep the spirits up during this period of isolation. Also make sure you have enough of fluids and water too. Remember to disinfect all surfaces, door handles which are touched by the patient so that nobody else gets infected from fomites. So you can see here we are using an alcohol spray to disinfect the door handles, light switches, all the remote controls, and don't forget the Astro remote as well. Just remember these guidelines from WHO. Adequate levels of vitamins D, C and zinc are important for a well-functioning immune system. However, it does not treat or cure COVID-19 infections. During my isolation, I took vitamin D supplements, a combination of vitamin C and zinc supplements through redoxon tablets. These are effervescent tablets containing both vitamin C and zinc. It needs to be dissolved in water before drinking it. What about ivermectin? All the studies have shown that ivermectin doesn't work. There's no evidence at the moment that it has any benefit in treating COVID patients. You can take simple medications like strepsils and lozenges for sore throat and Panadol if you have fever. Also, you are encouraged to continue whatever medications you are taking regularly. Another good tip here is to gargle with Orodex antibacterial mouthwash solutions 3 times a day. Although Orodex is an antibacterial, not an antiviral agent, there is always no harm in having proper mouth hygiene. When is a person discharged from home monitoring or home isolation? They have to fulfill certain criteria. For patients in stage 1 who do not develop symptoms at all, category 1, they have to stay in isolation for 10 days from the date of the test result. For patients who are symptomatic, that is COVID-19 category 2 with mild symptoms, you have to stay in isolation for at least 10 days from the onset of symptoms. And for the past 24 hours, they have not had any fever or need fever reducing medications. And their mild symptoms are getting better. Then they can be discharged from home isolation. So after 10 days of isolation, on day 11, you answer the same questions again. Once that's done, your MySejahtera app will be updated to show that you are low risk and out of isolation. Well guys, that was my video on the home isolation guide for a patient with mild COVID-19 infection who needs to stay at home for home isolation. Till the next time from Life at 50. Cheers.